So how can technology be incorporated into antimicrobial stewardship programs to strengthen them? There's a couple different ways I can think of. When you say technology, one of the first things that comes to mind are the electronic healthcare records that are now in almost all U.S. hospitals. So when I look at those, they do a lot of things, but do they actually help you do stewardship? And the answer to that depends which one you have, but they can be helpful, but you as the healthcare professional has to talk to the IT person to tell them how you need the program to run to make it useful for stewardship. So for instance, when a physician would go to enter an order for an antibiotic, do the indications for use actually come up or not? And if not, then you actually don't know what they're prescribing it for. And now that means someone has to call the physician, and it's a very inefficient way to function, especially if you're working in a 1,400 bed hospital. There's not enough hours to do that for every antibiotic order. So electronic healthcare records can really help stewardship programs. For instance, we implemented the management of Staph aureus bacteremia using technology at Ohio State, meaning we created an alert as soon as the blood culture turned positive. The pharmacist was notified, and then they would go into our electronic healthcare records, and there was a template we used to make sure the management is consistent and evidence-based. And so we were able to improve the management of staph bacteremia 24/7 around the clock in a huge hospital, deploying pharmacists utilizing the electronic healthcare record. There's other examples where you can develop medical apps to guide physicians, pharmacists, nurses on how to prescribe and utilize and monitor different antibiotics. So there's a lot of different ways technology can help us, and those would be two that I'd say are probably at the top of my list.